Throat by Angela Gemma, Katie Burke, Kristin Hood, and Olivia Wright. What is strep throat? Strep throat is also called streptococcal pharyngitis. It's a bacterial infection that can make your throat feel sore and scratchy, and it only accounts for a small portion of sore throats. There are other strains of the bacteria that can cause a sore throat, and if untreated, strep throat can cause serious complications such as kidney inflammation or rheumatic fever, and it's common in individuals ages 5 to 15. And here we have a nice picture of someone with strep throat.
Strep throat is caused by a bacteria formerly known as Streptococcus pyogenes. When you look under the microscope, it is shown as gram-positive bacteria that are round in shape called cocci. They also appear purple. This bacteria is non-motile, which means it cannot move, and it is also non-sporing. It causes localized inflammation, and it is aerotolerant, which means it is capable of surviving without oxygen. Transmission. It can spread through airborne droplets when someone with the infection coughs or sneezes near you. It can also be shared if you share food or drinks with someone who carries the bacteria. Environmental factors that can make it worse include cigarette smoke and chronic postnasal drip.
Signs and symptoms. Signs and symptoms of strep throat include sudden fever, sore throat, a red throat with white patches, headache, chills, swollen lymph nodes, difficulty swallowing, as well as a red swollen uvula or tonsils and a gray furry tongue. Symptoms of strep throat develop within 5 days of exposure to the bacteria. Diagnosis. To diagnose strep throat, your physician will probably order a rapid strep test where they take a swab of the back of your throat, send it to the lab, and look for bacteria. If the test comes back negative, but the doctor still feels that you may have strep throat, they'll take another swab and send it to the lab. While the rapid strep test can take up to 5 minutes, if they send it to the lab, it can take 2 to 3 days.
Strep throat can be treated with antibiotics, amoxicillin and penicillin being most commonly prescribed. Serious complications can occur if left untreated, such as kidney inflammation or rheumatic fever. With treatment, strep throat can be cleared in 7 days. Downside to antibiotic treatment are allergic reactions, especially in those who have never taken these antibiotics. And severe allergic reactions occur in 0.24% of patients, meaning that if 10 million people were treated with antibiotics for strep throat, as many as 24,000 will have a fatal or near fatal allergic reaction. So the purpose of the research is to determine whether the benefits of antibiotic treatment outweigh the risks. But research has shown remarkable benefits in terms of symptoms with use of corticosteroids. So strep throat is no longer contagious in those taking antibiotics after 24 hours, but those not taking antibiotics are contagious for up to 3 weeks. And it's uncommon for someone with strep throat to have a sore throat for longer than a week.
Here are our sources, and thank you for listening.